Angela Valenzuela, I wanted to ask you, even before Sebastián Piñera came to power, way back to the period of Pinochet, Chile became an example of privatization of neoliberal policies in Latin America, of the pension systems, of health and others. How has that affected this history of privatization? How has that affected the ability of the country to deal with the coronavirus now?
Well, what is really showing and demonstrating is that this system of extreme neoliberal policies and economic system, it's failing to protect people when a crisis like COVID-19 shows up unexpected, without any expectation. It's as serious as people don't have access to water to wash their hands. Like 1.5 million people in Chile don't have proper access to water. Then the healthcare system already collapses every winter without COVID-19. So we are very soon going to collapse the whole system of healthcare. People won't be able to have access to even ventilators. Like we are 18 million people, for example, and we only have 1,500 ventilators, and already most of them are used. We only have 500 available. We have more than 10,000 cases already, and the plans that were announced last Sunday is that slowly we will go back to a new normality, which means that public workers this week had to go back to work, which means that since May, classes, like students will have to go back to classes slowly, which will put their lives at risk, basically. So this sense, like it feels like the decision-making actually, the decision-making is not putting people's well-being at the center, but basically trying not to commit the well-being of the economy. Not only climate protesters, but protesters in general, all strikers and the Chilean movement is saying that, you know, another way to fight is to stay home and to take care of each other, strengthen our networks through online organizing, and to have memory of what has happened in Chile in terms of the environment, and as well with the human rights violations. We will not forget the people who have been murdered. We won't forget how we have sacrifice zones and how, like, even pollution in our cities are also making us more vulnerable to the COVID crisis. So once we go back to the streets and this crisis, this health crisis, basically stops, or we go out again, we will go stronger. And I think this is a very important moment to reflect on this system that is not working, and also to push forward for the change that is needed.